For the pathophysiology of the jaundice, we have to know that how jaundice is produced. Jaundice means the hyperbilirubinemia, when there is more and more bilirubin in the blood. How bilirubin is produced? We can see here that this in the mast cell, the red blood cell is break down into the globin and the heme. This heme convert into the biliverdin and finally into the bilirubin. This bilirubin released into the circulation and they go to the liver. Here the liver, the reaction is happen like this. Here is the bilirubin, and this bilirubin will conjugate it with the glucuronic acid, and they get the conjugated bilirubin. In the liver, the conjugation occurs. So in the summary, we see that the bilirubin, this bilirubin is unconjugated. Here is the conjugated bilirubin. This conjugated bilirubin has the capacity to excrete through the stool, through the bile, and some part of this conjugated bilirubin is also excreted through the urine. This is normal physiology of the bilirubin. When there is the pathology and there is the more and more bilirubin, then this clinical condition is known as the jaundice. The bilirubin may be increased in the circulation due to increased production. And here there may be increase of the bilirubin due to pathology in the liver cell, or there might be some pathology in this outflow of the liver that may cause increased bilirubin. When there is the increased production of the bilirubin in the macrophage, this type of jaundice is known as the prehepatic or hemolytic jaundice. When there is pathology in the liver, this is known as the hepatic jaundice. When there is the pathology in this excretory duct, obstruction in this excretory duct, that is known as the posthepatic or obstructive jaundice. So when there is more and more production of bilirubin, that will cause the more and more production of the unconjugated bilirubin. This unconjugated bilirubin goes to the liver. Liver is normal. Here conjugation will occur, so that there is some part of this fetal estercobilinogen and the urinary urobilinogen will present. The stool and urine will be normal. If we test the blood of this patient who has the more and more production of the bilirubin, we find that the more and more unconjugated bilirubin, and the stool and the urine is normal. When we find when there is pathology in the hepatocyte, then the conjugation will occur. It will be defective, and the excretion also will be defective. For this purpose, for this reason, we see that in the hepatocellular jaundice there is increase in the conjugated bilirubin and increase in the unconjugated. Both will be increased. And in the obstructive jaundice, where there is some obstruction in this bile duct, they may be into the hepatic, in the intrahepatic, or in the extrahepatic. The obstruction might be this level or this level. When there is the obstructive jaundice, there is the production of more and more conjugated bilirubin, but this conjugated bilirubin cannot be excreted through the stool. So in this type of the pathology, where there is the obstruction in the circulation of the bile, there is more and more conjugated bilirubin in the blood. The increased conjugated bilirubin will be excreted through the urine. This is soluble, water soluble, so they will be excreted through the urine. We will find that urine is high color. Normal urine get the urobilinogen, that is colorless, but when there is the conjugated bilirubin, this is colorful, so urine will be darker color. And in the stool there is no bile, so the fat absorption will be defective, so stool will be frothy. The normal color of stool will be lost. The stool will be pale and frothy in the obstructive jaundice. So in summary, we see that what will happen in this type of the different type of in the prehepatic jaundice, there is more and more unconjugated bilirubin. In the hepatic jaundice, both conjugated and unconjugated bilirubin will be increased, and in the post-hepatic or obstructive jaundice, there is only conjugated bilirubin. So if we do a biochemical test in the blood, we see this thing. And in the urine, you see that the conjugated bilirubin in the prehepatic jaundice will be absent, but urobilinogen will be normal or increased. But in the post-hepatic jaundice, there is more and more conjugated bilirubin, but there is no urobilinogen. And in the stool, we see that if stool is normal, prehepatic jaundice, normal dark brown color, but in the hepatic jaundice, it is clay or frothy color. This is the pathophysiological changes that occur in the jaundice.